Welcome everyone to the How is the Air Treating You webinar. Um, I would like to take a moment to introduce our presenter, Sheila Caldwell, and we want to welcome her. Sheila is a New Jersey school nurse who is currently on loan from her school district to be in fellowship with NEA. She is currently working in the ESP Quality Department and is a specialized instructional support personnel fellow, or what we call a CISP. So without further ado, I would like to welcome Sheila. And Sheila, you can take it away.
Okay, well, thank you so much, Jessica, for that warm welcome. And good evening to everyone who is in attendance for this evening's webinar. I wanted to just say it's really important that you understand what a SIP is. And those are really the non-classroom facing professionals that have a license in the general sense of it. So it's nurses and counselors and librarians, physical therapists, occupational therapists, and other individuals that have a license that work in the school setting. So if you're not familiar with it, President Obama had coined it back in the Every Student Succeeds Act in 2015. Next slide, please. So here are general objectives. You can look over these. You'll understand a basic part of anatomy and physiology of the respiratory system. You'll learn about some air issues, have some conditions that affect respiratory system given to you, discuss a few treatment options, and provided with a few resources concerning air issues. It's at this time that we want to just kind of see who's in the room right now, who is online with us. So we do have one poll, and there are a lot of options here. So if you can scroll through them, and these are based on how the NEA has some of the classifications for ESPs, for educational support personnel, and then we do have teacher included. And if you are not of that range, just hold tight. And you can put it in the chat. So Jessica, if you want to share with us the poll results, just to kind of see who is here this evening. And it looks like we have some maintenance, health and student services, and paraeducators. So thank you so much for that. Next slide, please. So we're going to start off by looking at the respiratory system. You probably learned about this in approximately 4th grade, about the different body systems and all that, but we're going to just kind of go over them, but in a basic manner at this point in time. Next slide. The upper respiratory system, or upper respiratory tract, has a main function of warming and filtering the air of the particles that we inhale. Obviously, it does not filter all particles, and it's not successful in being able to do that. We'll talk a bit more about the particles as we go on, but the upper respiratory system, or upper respiratory tract, consists of the nose and nasal cavity, the pharynx and the larynx. These structures allow us to breathe, to speak, and as mentioned, warm and clean the air that we breathe in. The mucous membranes lining our upper respiratory structures trap some of the foreign particles, including smoke and other pollutants, before the air travels down to the lungs. Next slide, please. The lower respiratory tract's main job is to have the place for the exchange of oxygen and carbon dioxide. The lower respiratory system, or lower respiratory tract, consists of the trachea, the bronchi, the bronchioles, and inside of the lungs are the alveoli, where the actual exchange of oxygen and carbon dioxide take place. These structures pull in the air from the upper respiratory system, absorb the oxygen, and release the carbon dioxide. Now, remember, I know, this isn't a medical course or anything, so we just did want to mention briefly about this, because it's very important to understand how the air is getting in our body. And what's mentioned also in this diagram is the diaphragm and the thoracic cage. The thoracic cage just kind of keeps those organs in place. So when you inhale and exhale, they're not overextending. But the diaphragm plays a major part in this. It's a muscle, and it contracts rhythmically and continually, and generally involuntarily to aid in the inhalation and exhalation. So just keep in mind, just basic information about the respiratory system. Next slide, please. So when we come into the world, we basically are coming in free of any exposures from the external environment. Our respiratory systems are more or less perfect along with the rest of our body systems. We can speak to there being exposures to the fetus when in utero based on the mother's exposures to substances or abuses and things. But generally, for typical children born, a typical birth, you know, we are free of any kind of exposure to the environment until we have our first cry. And it's at that first cry that anything that's in the air starts then to affect us. The normal, and that's in quotes, progression of growth and development can then be hindered by whatever's in the air. So let's now take a look at the air. Next slide, please. If we think about historically evolution of what has impacted the air we breathe, we can first look at the natural environment of trees, plants, shrubs, and flowers. They didn't have contaminants that could impact them, but do have some components that once they get into the air can affect us. Can you put in the chat some of the suspects from the natural environment that can affect our respiratory system? Let's see if anybody can put in some of these things. Yeah, pollen, definitely. Fires like that. Yep, allergens, exhausts, and that. This is natural environment. Okay. So yes, pollens, oils, saps, main culprits when we really think about the natural environment. Yeah, pollutants and things. Next slide, please. Grass, yeah. So as things evolved and also thinking about, historically looking at things, the other species in our world, the dogs, the cats, the rodents, the insects, and any other species out there, there may be a direct reason why they interfere with our respiratory system, but as we have learned, mostly it is their dander. The dander is the dead skin cells of an animal that carry proteins on their fur or in their saliva, urine, or feces. And, when we speak about insects, they generally are not the culprit in and of themselves in the natural habitat. It's what they carry on their bodies when they bite or sting you. Next slide. So I'm hoping you can kind of get a little bit of a gander at this slide, depending on what view you're looking at. But, when we think then, looking at that evolution, what started happening next in our nation? The world started trying to think smarter and have more efficient ways of getting things done, from just farming and moving on. There was that major initial boom of the Industrial Revolution, and there have been a few more since then. And at this point in time, there's been a lot of progress. And it's happened actually on the backs of many of those who are enslaved and marginalized. But at this point in time, we really have to look and think about all these different things that happened in our history that have causing issues with our air and our environment. So start really thinking about what has happened to our environment as time has moved on. If you can share in the chat some of the milestones or inventions that had affected our air, add them in the chat. And although great for our country, when we think of progress, it's been detrimental to our air. Money and stature have been in the forefront when thinking and without thinking of the consequences to us as human beings. Remember the progress was not only in the US, it was globally. So you can imagine what effects have been done to our air. Yes, there are all these emission concerns, as you're putting in the chat, from factories, from cars, from trains, from planes, etc. The chemicals emitted from these and other methods affect and still affect our air. You know, we can go on and on about this, but looking at today and how unhealthy our air is, we know our respiratory systems are being affected. And what we know as individuals is that then obviously affects our personal health and continues to affect the environment. Because of some of these environments, I do have to mention irritants, because there are different than allergens and different from these other items, although some of them can be considered irritants as well. But things like secondhand smoke or perfumes, wildfires, as you're mentioning, they can be in the air and can also cause harm. So we are going to watch a short video that is on the next slide. Thank you for sharing all that in the chat.
Irritants are things that can trigger asthma or allergy-like symptoms. They may not necessarily be an allergy like a pollen or a mold or cat or dog, but they can be equally bothersome. Some examples would be things like cigarette smoke, strong perfumes or chemical smells, infections. Sometimes just changes in temperature or humidity can be really irritating. Many people who have allergies are also sensitive to irritants. Many people just are sensitive to the irritants, but it is extremely common. Symptoms people usually would notice would be watery eyes, runny nose, congestion, sometimes drainage down the back of the throat when they're around those specific triggers. Avoiding them is really important. The irritants like humidity and temperature changes are tough because that's just part of the environment and we all have to go outside, and so those are a little trickier. Some of the others, like the strong chemical smells, you can try to avoid things like bleach or ammonia for cleaning. Because these things are hard to avoid, medications can be really important to control your symptoms. Interestingly, allergy medicines work really well for these irritants as well. So a lot of times for patients who have irritant triggers, we still use the same types of medicines as if they have allergies. So things like nose sprays or antihistamines can still be really helpful.
So that video, stop it now. That video just gives you a little bit of overview of irritants, because many times irritants get mixed up with allergens, and obviously we know people do go to some allergists and do get tested to see if it's an allergy versus an irritant or something else. And you know, they did talk about a few treatments, and we're going to just kind of put a pin in that for now and get back to that and focus back on some respiratory conditions. So I decided to share this slide because it kind of gives that overview of looking at how the symptoms from these viral situations seems to, you know, kind of cross over in addition to allergies. Allergies is not viral. I did not include actually find one that actually also included RSV, although RSV is affecting our very young and very old, and we do know that they're in the works of trying to create a vaccine for those. But the symptoms can be confusing in what is really going on with you. And we know that it really takes diagnostic testing to determine which viral situation may be a culprit. In some cases, as the video spoke with irritants, the treatment might even be medications that are for allergies, but they also work otherwise for other conditions. And I do have to mention, with so many over-the-counter medications at this time, you can speak to your pharmacist about them for a condition, or your provider based on what you've been diagnosed with from the diagnostic test. Next slide, please. Another upper airway condition that basically treated the same is hay fever. Hay fever is an allergic rhinitis, so it is an allergen-based situation where the body's immune system recognizes an irritant allergen and overreacts to it. Um, there's many people that have these, and they're either seasonal, where it can happen as the weather changes, and is could even be from things like airborne mold spores or pollens and things, or perennial, where year round they might have this concern. And this could be really more from things that are inside, things like pet hair, the dander, dust mites, cockroaches, mold, etc. But the treatments we have to think about might be a little bit different. Um, Based on them being indoor exposures, you might want to keep your windows closed, have your air conditioning on in vehicles if you have to go out. Might proof your house, like pillowcases and comforters and things that have the covers that um, on them, and washing the bedding frequently with hot water if it's at all possible. Um, in addition, humidity in the house becomes a factor. Um, and we do want to try to keep it at 30 to 50%. For those folks that like those really hot showers, it's a good idea to crack that window open just for a little bit to let out some of that uh, condensation that accumulates, or have a dehumidifier even in your house basement and those things as well. We know that in a sense, having a clean home from that perspective can help to reduce some of this. And the medications could be, as I say, similar to some of those mentioned for allergens, like, and that also help maybe to reduce nasal congestion, and or if the nose is running, it depends. We get them both. We get the runny nose or we get the congestion, and it's hard to tell sometimes what needs to be given. But nasal corticosteroids are usually very often given because of the air passages, and the sneezing as well with antihistamines. Because I didn't mention bacterial infections in the upper airway in these slides, I do have to bring them to light now, because we know people get sinus infections and things like that, and they would warrant antibiotics. And I would caution you to not abuse antibiotics. We know a lot of folks go to that even when they do have some of the viral situations. And yes, some of the viral situations may then later not develop themselves into a bacterial, but a bacterial infection may be coexisting. And it would be important to see a provider so they can order for you the right medications should there be a bacterial infection in your system. Next slide, please. Okay, we've seen an image like this probably for the last 3 years, basically. And it's just something we need to keep in mind, because to safeguard yourself and others from viruses or even bacterial conditions, we do have to think about how we can do that as an individual basis. Is, wearing the mask, making sure ventilation is appropriate, avoiding crowds, and also being tested. Um, there are all kinds of tests out there now that are combined, where they can even check for all the 3 or 4 things, whether it be the RSV, the COVID, obviously testing for allergies are a whole different setup, but it's really important to have this done. And we really have to add to this conversation vaccinations. Now, these are important, and you should really speak to your provider and really sit down and have that conversation based on your own health history, based on your family condition, based on your living conditions, and otherwise work conditions as well, to determine what vaccinations you should have, when you should have them, and how obviously they should be given to you. We know this is a topic that is sometimes talked about in different ways, but the biggest thing is having that conversation with your provider about your need or to have the vaccinations. Next slide, please. So we're going to move on to the lower respiratory tract, or actually some diseases that are found in the lungs. And there's not too many that really affect the bronchi or the bronchioles in and of themselves, other than when something's an inflammatory situation. But we'll look at more what affects the lungs. So I hope you can kind of see this slide and see, obviously, when things enter your nose, they're eventually going to go down to your lungs. But the question is, how do they affect your lungs, and will they affect your lungs? Some of the things with the bigger particles are obviously going to have, smaller particles, I should say, are really going to affect it in a more time, affect it more. So when we think about these and look at this list, what I want you to put in the chat is who do they affect the most? So when we're thinking about influenza in terms of age range, very young children, adults, or elderly. So who is mostly affected by influenza from your perspective? Very young children, adults, or elderly. So the reality is influenza does affect everyone, maybe a little more detrimental to the very old and the very young, but we do know that that's a factor. How about the next one? If you've heard of COPD, chronic obstructive pulmonary disease, who's that mostly affect? Yeah, smokers, elderly, older folks. Yeah, because they, over time, their lungs have changed based on what has been in the air that has affected them. And the biggest culprits are the smokers, the people who smoke. And yes, factory workers can also be in that. Let's move down to tuberculosis. What do you think? Okay. Tuberculosis, more or less in the United States, is not so much as prevalent as it used to be. We do get it occasionally, pockets where people have tuberculosis, or from specific countries where it is higher risk. And yes, it can be at any age, and many times providers will at some point do what they call a MAN2 test or a TB skin test. And you might have had that done possibly when you started your job, because they usually look to check that. Okay. Yeah, folks, urban areas, yeah, people that are in more condensed spaces. There are treatments for it, and just know that. Now, lung cancer. Now, it's in this as a listing of diseases because it is, but it's not so much something that affects you based on the air. It's whatever is internally going on with you, but the air could too. And we're finding this out and have known this, like from 9/11. They have talked about having those major lawsuits where people that have developed lung cancers from inhaling all of those particles and things like that, from like when 9/11 happened, and from other situations, even some of the wildfires and that kind of thing. But as you see, these are the main diseases that affect the lung. And obviously the air is a major culprit to this. Next slide, please. Okay, so we talked about the particles a little bit, and the finer particles are the ones that really get down deep. So as you see, they can cause some of these symptoms, and even to the detriment of having cardiovascular or heart disease. or, making some of these other things worse. So we really need to be careful of the air that we're around in given environments to really think about, is the air affecting this? All right. Next slide, please. Now, this just is a word cloud. I had searched information about different particles that are in the air, mainly by way of emissions. And a number of you mentioned, I even saw like PCBs and things that were mentioned earlier when we talked about what's in the air when it comes to industrialization. And so, there's all these different things. They affect some people, but many times they don't affect anyone. So depending on your general health, there are times when some of these particles may or may not affect you. So just be aware that there is so much that's in the air. We really have to be concerned about it. Next slide. So as you can see in this image, there's cigarettes and there is one of the vape pens. Vape pens have evolved into looking like toys and looking like candy and looking like everything else. But we know that smoking is still very concerning. And so many people have now turned to vapes. They're not realizing the damage that is being done to their respiratory system every time they inhale, as we know. And we do have to be concerned about the secondhand smoke that happens from cigarettes, as well as vapes. But there's really no research out there yet that I have seen about secondhand smoke from vapes. But I'm sure as time goes on, we got to keep watch for it. The biggest culprit here is the addictiveness of the nicotine that people have to these two items that causes them to keep smoking and smoking it. So something to keep aware of, and we're just seeing more and more information come out from the FDA about really trying to go after some of these companies, similar to how they did with cigarettes for the vapes, to maybe take down the signs or not have things advertised in certain ways. So we really might not be able to change our living conditions or the geographic areas of where we live, but we can look to organizations for avenues of advocacy to improve air quality. Whether you're starting to look at external air or indoor air quality, there are opportunities that you can be involved in. Contact your Department of Health, ask your school district's health and safety team, search your states for organizations. There are so many. Contact your union. They have resources or can help you find out more information if you have concerns. So when we think of indoor air quality, we can talk about filtration systems that need to be put in place and filters. Maybe a good time of the year that these should be done in your home and in businesses and schools, etc., is when the time changes. So if you're in a state where it recognizes the daylight savings time versus the standard time, maybe that twice a year when you're also changing batteries, because that's when they tell you to change your smoke alarm batteries too. Maybe that's a good time to start considering this. Have your heating and air conditioning systems serviced on a regular basis. Some individuals in single family homes also have their air ducts cleaned. Obviously, these other buildings should, and edifices that we know out here in the public should, but we don't know if they do. So you can always ask questions, especially if it's in publicly owned spaces about that. And we must always have those conversations with our providers about some of these things that are in the air that we just have to live with, and know that there may have to be the need for medications to maintain good respiratory health for you. Next slide, please. So this slide just brings to light that the EPA has a new environmental justice division and has easy online tools to check air quality outside. Now, there are some schools that even participate in the EPA's outdoor air quality programs with the flags, as well as some that participate in their indoor air quality programs as well. So, ask about that in your school setting if you are familiar with that, that this is being done. If not, you can always search on the EPA's website about the two programs. But as I say, this one is about the outdoor air. So you see on there, there's the colors that denote the quality of the air at the time from pollutants, from particle pollutants. And I yesterday did a sampling. So if we can go to the next slide. And I plugged in information for Washington, D.C. last evening at around 7 o'clock. And the air quality was good. And this website is airnow.gov, AIRNOW.gov. As you can see across the top there, you can plug in any town or zip code, and then across the banner on the actual page that I had the reading, you can see that you can detect where fires are. There's educational information. There are other things about air quality that you can access there and see what's going on in your own neighborhood. In relation to fires, we do have to think about the buildings and things that are near them, especially our schools. And, they're being affected. So maybe instead of those filters and servicing being done that twice a year, as I'm just saying that as a general base, maybe it'll needs to be done more often. Because we want those particles that are floating in the air to be captured in those filters, and then they need to be changed. They can only hold but so much. So really keep that in mind if you're in areas where there has been higher air quality concerns of how often things are being changed. Next slide, please. So as I mentioned, the EPA has an environmental justice office. The main office is in North Carolina, but here on this slide shows the list of regional offices that you could contact should you decide to. You might be interested in learning more about what's going on as far as the EPA goes. I did not mention the ozone layer and how that's being affected by the air, although we know that that is also a concern for us as people, more, and obviously just the environment in general. But you can always contact the EPA office or check out their website for any kind of information about that affects the environment and that you may be concerned about as far as air quality, indoor or out. And the next slide, please. So that's the end of my part of the presentation, and I'm going to turn it over to Jessica.
Thank you so much, Sheila, for that informative presentation. And so at this time, we are going to open up the floor for Q&A. I see that there's one question so far that was posted in the Q&A feature, but if you have other questions, this would be the time for you to start typing them into the Q&A feature. And as a reminder, only the questions that are posted in this feature will be included in this portion of the webinar. So start getting those questions in as I ask this first one. So Sheila, your first question, I'll read it to you. It says, increasing ventilation and adding portable HEPA air filters have been some of the top recommendations from experts to improve indoor air quality in schools. Some schools are placing more experimental products like ionization into their schools. The EPA just said that ionization is not very helpful to clean air and can actually be harmful. What should parents do to help advocate for the recommended IAQ improvements And do you think a legislative approach to IAQ in schools is necessary?
So when I think about this, we have known from the research that ionization isn't necessarily always the best thing. And as you're seeing now, this is coming out from the EPA and others. But what I will say is, as far as legislating for it, it probably is the right route to take, because people in certain areas don't understand or don't get what's going on. And right now is a prime time when we talk about indoor air quality in schools, because there has been the infrastructure infrastructure act that was passed, presented by the president. And there are allotments of money to go to infrastructure maintenance and upgrading and things like that. So I would advise that you find out information, possibly even for parents through the unions, of what products would make the most sense, and how can parents then also become involved in that, I don't want to say fight, but in that advocacy toward improving the quality of air in the school. There are so many resources out there, and I do believe that it ends up mostly being legislative. But as I'm mentioning, find out where those dollars right now are going from the infrastructure act that just was approved, and the funding is going to be going to states very soon. Find out where that money's going, what districts are getting them. Where is your state governor going to decide to send this money for the school, and decide which schools need the improvements? So very much so important. Yes. And someone put in about the ESSER funds. Yes, there's been a lot of money that's going to schools for an array of things since the height of the pandemic. So, just find out who those partners are in your state. The school nurses definitely have indoor air quality at their best. OSHRAE also was mentioned to me, and OSHRAE has standards for buildings, and for schools, it's ASHRAE. So it could consider looking at information on their website and how then buildings can be considered. Yes. But the biggest key is we have to have good air for everyone on this planet, including our children. And they many times are left out of the conversations when we think about this. But we have seen a lot of stepping up, of youth and young people when it comes to environmental justice. So they're the ones to get on your side too. Hearing when school boards and folks hear from kids and hear from the parents, sometimes they are the best ones to make the plea for change.
Thank you so much, Sheila. All right, so I think at this time we have answered all of the questions that have come into the chat. You'll see that there was a resource that was actually dropped in the chat by Sheila that many of you were asking about. So there is one of those resources for you. But at this time, we don't see any more questions. So we are going to officially close the Q&A portion of tonight's webinar. And thank you so much for your active participation in that. To request a general session-specific certificate of completion as a participant of recorded sessions, please send your request by emailing espqweb@nea.org. All requests must include the session title and the on-screen certificate of completion code. Session certificates will not be provided if your viewer code is not included in the email request. Note, due to limitations in our ability to track attendance after live sessions, requests for personalized certificates will only be provided for participants of live webinars whose attendance can be verified. The certificate received for viewing recorded sessions will be session specific, but will not include personalized names. On behalf of the Center for Professional Excellence in Student Learning's NEA ESP Quality Department, I would like to once again thank Sheila for her informative presentation tonight, as well as all of you for participating in our webinar. Please stay safe, stay healthy, and good night.